Major announcement by the American Cancer Society today. Colorectal cancer screening should begin at age 45. That is 5 years sooner than what is currently recommended. Joining us now to talk about the importance of this change is Dr. Bruce Waldholz, a local gastroenterologist. Thank you so much for joining us. Why was this change made?
Well, thank you, Regina. This change was made because of the research done by the Intramural Research Unit of the American Cancer Society showed that the rates of colorectal cancer in individuals under the age of 55 have actually been slowly increasing since 1994. In addition, the rates of Americans who are in their 20s and 30s, although low, have been rising. We don't know exactly why, though it's been postulated that perhaps increased obesity or perhaps increased inactivity. So the American Cancer Society team over the last year or two looked at simulation models to see what number of Americans would be affected and looking at the harms and benefits. In the last Census Bureau data, there are 22 million Americans between the ages of 45 and 49 in the United States, and in Virginia, 620,000 Virginians. In our area here in Hampton Roads, we're talking about 127,000 people. For the last 2 years, the American Cancer Society has led a coalition involving the Virginia Health Department, Eastern Virginia Medical School, and the 4 healthcare systems here: Centera, Riverside, Bon Secours, and Chesapeake Regional. And we've had 5 statewide roundtables looking at screening rates and barriers, including in populations at risk, including federally qualified health centers.
Okay, quickly, the high-risk groups, and they've come up with a plan that is making it far less invasive to screen
Absolutely.
for cancer.
There's no question the African-American population were at increased risk. Looking at federally qualified health centers over the past few years using stool tests, fecal immunochemical testing that must be done every year, but over 10 years will have the same mortality rates as doing a colonoscopy every 10 years. The new guidelines are for average risk Americans. If you have a family history of colon cancer or colon polyps, particularly in a close relative, you'll likely still need to be screened at age 40 or 10 years before the age of that relative. In terms of this new guideline, it recommends that screening be done because the best test is a test that gets done. And that is either a test that visually looks at the colon, either colonoscopy every 10 years, a virtual CT, which is a specialized CAT scan every 5 years but involves radiation, or a shorter test called a flexible sigmoidoscopy every 5 years, which is really not used that often in areas with access to gastroenterologists. The other tests that can be done are a stool test called a FIT test every year, or a stool DNA test every 3 years, which is much more expensive in terms of modeling. Any of those tests, if they are positive, must be in the new guideline, immediately followed up by a colonoscopy.
Great advice. We're out of time. Thank you so much for joining us.
Thank you, Regina.